All right, we're now joined by Professor Zozo Nene, the president of the College of Obstetricians and Gynecologists. Prof, thank you so much for your time this afternoon. Now, this, of course, is a very concerning topic that we're discussing this afternoon. I mean, what is of concern is that while the WHO continues to report a decrease globally in the adolescent birth rate, in South Africa, that rate continues to rise every single year. And I mean, we're talking about children between the ages of 14 and 19 here. How concerned are you about this, particularly the dropout in school?
Thank you very much, Nati, for the invitation. I've always really insisted that this problem is a problem of South Africa. It's not only a problem of one sector, whether it's health, whether it's education. We need to come together because the statistics are showing exactly that in spite of some of the programs that some of the sectors have, the teenage pregnancy continues to rise. So clearly, there is something that we are not doing right. So we need to go back to the drawing table and we need to come together as South Africans and make this a collective problem and try and address it with each other. So what I think is really one of the major problems is that the teenagers are not being made a part of this conversation. We have not asked them what it is they want, and we don't know if they have issues with access of contraception and issues with access of information, which is very important, because in the end, they have to be part of this conversation and they have to take responsibility for what happens to their future and be able to prevent these pregnancies. I think if we are not making the teenagers, the parents, the communities, and all the health sectors part of this conversation, we are not going to win, and we will continue to see the rise of all this teenage pregnancy every year.
And something that your organization has raised a number of times is that a lot of the time when we look at these stats, is that we don't consider a number of factors. Number one, the complication associated with teenage pregnancy and childbirth, for a child that is that young to actually give birth. And secondly, that some of these children are rape victims. I mean, we are talking in the main about children between the ages of 14 and 19, but in some cases, 2 years ago, we were talking about a 10-year-old child giving birth. I mean, this is also another matter that the law enforcement authorities should also be looking into, don't you think?
Most definitely, they need to get involved, but us as healthcare providers as well, because we should know what the law says. And the law says statutory rape is when a child less than 16 years of age is having sexual and unconsensual sexual activities. However, it also does say that if it is an age mate, someone of the age group who is less than 16 years of age, that is not a statutory rape. And if the age is within the 2 years difference, then it's not statutory rape. However, so when we see these children coming to give birth in our facilities as healthcare providers, do we ever ask a 10-year-old who made you pregnant? I think we should start collecting those statistics, and we should start reporting it, and we should start making sure that the law is held accountable as well, that we cannot have these males perpetuating this statutory rape, not being arrested and brought to book. So we need to have all the organization in place. The healthcare providers should report to the Department of Social Development, and we should be reporting these things to the police station, and the police must get involved, and the law must take its course. I think it is high time that we have very strict rules and strict reporting processes that are in place so that we protect these girls.
And when you talk about rules, I want to also just touch on the fact that, you know, there is laws to protect the children at the moment. And that is also what is probably concerning. I mean, we've got the national and the global legislative frameworks that guarantee the right of equal education to young girls and young children in general. And it also addresses the challenges of school dropouts. Yet we are looking at these stats and saying, why are only a third of adolescent girls who become pregnant going back to school? So what is the problem there? I know that your organization is embarking on a number of programs this year to tackle this very topic that we are discussing. Just talk to us very briefly about what some of these interventions are and who you will be partnering with.
So what we as an organization at the College of Medicine or the College of Obstetricians and Gynecologists, we want to target something that is in our field, but we want to also involve everyone in us addressing this problem. So at the moment, what we can do as a society or as an organization is to educate the young children. They have to be part of this conversation. We have to give them information, and we have to give them that sexuality education and information about contraception, about safe termination of pregnancy, where to access it, because the other problem is access of all of these services. So we need to draw their attention to where they can access these services. Then we need to educate the healthcare providers that they must be the ones that are at the forefront of giving this information, of providing this service in a respectful manner. We cannot have children coming to request a service and our healthcare providers, they chase them away or they treat them with disrespect, or we are judgmental. We need to learn what is called respectful care and manage them with respect so that they know that they have somewhere where they can go to with all of their problems. Again, we need to make sure that the youth services, the adolescent and youth services are accessible and they function very well. So as a society or an organization, we are going to make sure that we impart the knowledge, we provide the service of contraception, and we provide the service of safe termination of pregnancy, and we go into the communities and educate the parents and the religious group and make sure that we are all part of this conversation and we are all part of the solution.
Professor Nene, a pleasure to have you on the show. Thank you so much for your time, Professor Zozo Nene. There, of course, a very important conversation following that more than 60% of pregnant girls did not return to school in the 2019-2020 financial year. That's according, of course, to the 2022 study done by the Commission for Gender Equality.